If you do not ask the doctor why they're prescribing the med or ask them questions, then you might have problems long term. Let's discuss anxiety meds and in more specific PRN medications in this video. More specifically, as stated in this video, we will be discussing anxiety meds. And these are some concepts you should always be familiar with if you're prescribed something new, and in particular, for example, even anxiety PRN meds. So number one, when prescribed a new medication, and we're in specific, once again, we're talking about anxiety meds today, which can be PRN, which could be benzos, which are addictive, or non-benzos. So when prescribed an anxiety med, always ask the provider questions. You should always ask them questions. Why? Because they're prescribing you a new medication. Be upfront with them. If they're prescribing you it, ask them, why am I being prescribed this? Be upfront. Is this addictive? Ask them, okay, if it's PRN, how should I be taking it? Because I'll be upfront with you. If you do not ask the provider these questions, a lot of times they see so many patients a day, they'll just prescribe the med and they'll say, take it as needed like this, or take it just, take it once a day, and there you go. You've got to be proactive about it. Even if you go in not anticipating a new medication be prescribed for you, this is something you should be aware of. Number two, only take the medication as needed if it's prescribed as needed. Honestly, with this in particular, with benzos, if you're prescribed a benzo or even a non-benzo as needed, take it as needed. If you feel an anxiety attack coming on in specific, take it for that reason. Don't just take it daily to take it if it's prescribed PRN. You'd be surprised how many times doctors would not actually tell you what an as needed medication is. You take it when you feel like you need to take it, typically once a day, maybe twice a day, but honestly, a lot of times there's typically a limit of maybe once or twice a day. So, and honestly, I put here, if directed otherwise, if it's daily, they should tell you that. Number three, if you forget to take if you took the medication, let's say is needed, or daily even, do not double up the medication. Especially if you're driving somewhere. If you're driving, you don't want to get lightheaded, dizzy, you don't want to come across as you're high or something like that as well. Be very careful with that. Rule of thumb, if you can't remember if you took it, more than likely you did, and even if you didn't take it, with anxiety meds a lot of times, it's not the end of the world. Same even with SSRIs and meds in regards to depression, which we'll talk about, some questions asked as well later in another video. But a lot of times, if you miss a day, if you didn't take it, it's not the end of the world. It's better than taking 2 doses of it. You should never double up your dose in any way, and in particular with benzos. So for example, Xanax, Valium, Ativan, Klonopin, never double up on those. That can lead to a whole nother array of issues as well. It can lead to addictions. It can lead to, if you do double up the medication, you're not taking it as prescribed, that can lead to, you're trying to refill your prescription early, you run out, and that can lead to some adverse side effects, such as seizures. So do not double up. Also like and subscribe at this point if you haven't already. Thanks for watching this far. Number 4, if prescribed a benzo, which I put right here as addictive, maybe ask about being prescribed a non-addictive anxiety med as well. So for this example, let's say you're prescribed Xanax, PRN, which is as needed, once or 2 times a day, daily, as needed. So your max dose would be 2. If you feel like that's a little too much, let's say it's 0.5 milligrams, you should always ask the doctor, is there anything we can take daily with that so we're not having to take the Xanax twice a day, maybe just once a day, or once again, if it's as needed, you might not need it for the day if you're taking something such as, let's just say, Buspar, Buspardone, which is essentially, it's a medication that can help a lot with anxiety, daily medication. Clonadine's another one, not Klonopin, that's a benzo, Clonidine. Also some SSRIs like Prozac could be one that's implemented. But yes, there are alternatives to benzos, because once again, as we jump into number 5 right here, if prescribed a benzo, Do not stop them abruptly. I know I hit that on pretty much all meds because you should never stop a med abruptly unless your doctor tells you to. Never stop a benzo abruptly due to the risk of seizures and rebound anxiety and worse anxiety. And on top of it, emotional swings. I'm trying to write this, but as you can tell, my handwriting is not good. So, never stopped abruptly. This is why you don't want to be taking your medication. You don't want to be overtaking it to where you run out at the end of the month, because there could be a time where the pharmacy is not in stock with it, so you should always have some extra on hand. Or if you're not taking it as prescribed as well, you can be out of luck, and you might have to go 3 or 4 days even if they do have it in stock, because a lot of times with controlled substances, you can only pick it up 2 to 3 days early, sometimes only 2 days early. So if you run out early on it, or you lose some of them, let's say it's a week till you can fill it, you might have some problems, because you'll be fine for a couple days without it, but once it's out of your system, and let's say you've been abusing it and you can't fill your med for a week, by day 3 or 4 without it, you might have some problems. That is why the whole point of this is if you're prescribed a benzo, talk to your doctor, ask them why they're prescribing it, and if there's anything you can use in conjunction with it so you don't risk the chance of becoming addicted to the medication and you're not taking it more than needed. And let's say they prescribe it as needed, let's say Xanax once or twice a day. At most you'd be taking it once a day, at most, with a scheduled non-benzo anxiety medication that's not addictive, so you'll at least have some left over at the end of the month. So if they don't have the medication at the pharmacy, if let's say they're out of stock, or whatever happens with it, you always have some on hand. That is your daily dose of mental health. We'll be covering as well. We'll be covering a video in regards to depression. Really, we'll be SSRIs, SNRIs as well, and what questions to ask doctors as well. This series is all about things you should know when prescribed new anxiety meds. We'll do one for meds for depression, SSRIs, SNRIs, and we're still have the DT video. We're working on the delirium tremens, but I want to make sure I have everything right on that, because I want to be able to apply it to not just, again, alcohol use disorder where you go into a form of psychosis, but I want to be able to apply delirium tremens being a form of psychosis to a lot of psych meds, and how, it might not be called or labeled delirium tremens outside of alcohol use disorder, but it acts very similar in a way of you can potentially develop forms of psychosis outside of delirium tremens. That is your daily dose of mental health. Like and subscribe, leave a comment. I love you all. Ask your doctor questions. Do it, because their job is they're going to prescribe it to you. I get it. But today they see so many patients to where you've got to be the proactive one to ask questions. I love you all. Have a great rest of the week.